first learned we were having twins when we were about 9-10 weeks pregnant. And then as soon as we go into the ultrasound and the tech puts the wand on and she says, oh, there's two. Ryan was like, yes, like he had scored the winning touchdown. He was so excited. We had care at other hospitals with different practices, and I was just another pregnancy in their day. It wasn't, there was nothing special about my pregnancy or me as a patient, and that was kind of what really led me to Doylestown, the fact that it was much more personal care. The nurses were phenomenal, so I definitely took a little coaxing and a little explaining for me, but it ended up being the best thing we could have done.
CJ and Ryan Nase were born in April, and they were both 34 weeks twins.
I went to the doctors and found out that my blood pressure had just kind of gone through the roof, and they were really worried that I could potentially have a seizure. So they said it would be in the best interest of both my health and the baby's health to deliver them.
CJ was much smaller, more than a pound smaller than Ryan. Having them in the NICU, having one-to-one care for these babies, even when they are completely stable, makes it easier to transition them to the regular nursery and to home.
They were really, really reassuring, and it actually worked out really well. So it was quite an eventful day for us.
Doylestown Hospital is a level 2 unit. We are licensed for 4 NICU beds and 1 isolation room bed. On an average, we see about 110 to 130 babies in a year. We provide round-the-clock, 24/7 in-house coverage in the hospital.
The fact that the doctors at Doylestown were associated with CHOP was a huge relief to us, just because they're so well known. They're on the cutting edge of what's going on in the preemie world.
We had almost 24-hour access to the babies, and they just made you feel so comfortable in the NICU, and you could tell not just Ryan and CJ, but that all the babies in there were just getting such great care.
My philosophy is to provide safe, effective, and evidence-based care to the baby, but not just to the baby, but keeping the whole family unit in center.
And then finally, the day came for the car seat test, that they were kind of big enough to go home and it was safe, and we were really, really excited.
It was wonderful. We were so glad to have them home much sooner than we expected.
I really admire Mother Nature as to how perfect the life is and how the life comes into this world.
It was overall just a wonderful experience for us.
We know that if we decide to have another child, we now know where we're going.
The joy that you see in the room makes everything I do worthwhile.